Wiggle your left big toe a little bit.
Wiggle it?
Yep.
The art of distraction. Oh my goodness.
What's going on out there in YouTube land? We are here today in La Jolla with Dr. Jess MD. She's an expert in all kinds of health issues, particularly holistic. She is a medical doctor, but she sort of looks at things through multiple lenses. So she's somebody you want to go check out at her website.
www.drjess.com.
There's tons of products there. Make sure to buy them with your money. So tell them a little bit about you're dealing with some tension headaches today.
Yeah, you know, it's weird. I have this frontal headache right on my eyebrows here, and also always my neck and shoulders, which is kind of where I carry a lot of my tension. So that's just kind of par for the course for me.
And you've been getting some myofascial work done, right?
Yeah, and it's been great. So awesome. Yeah, absolutely. I think that's kind of my recipe. So if you can kind of elaborate on that and tell me what's going on in my body with all that stuff.
I can try.
Yeah, I'd love it. I'll try to explain what's going on too.
First time's the charm, right? Good luck to both of us. All right, let's go ahead and sit right here.
Yes.
Essentially what happens is the trigeminal nucleus basically hijacks C1, 2, and 3 and the trigeminal nerve. So when you have a problem up top, particularly from the C1, 2, and 3 nerve roots, your brain doesn't necessarily know how to interpret that data. So it'll hijack the ophthalmic branch of the trigeminal nerve and you'll feel pain across your brow, your upper part of your head. And typically that comes with neck tension and problems like that. And one of the theories behind it, which is interesting, is that evolutionarily speaking, some of the parts of our body don't really have a lot of innervation, because if something was harming it, you'd probably be dead. The upper cervical spine being one of those, referral from visceral organs as well. They typically grab onto other pathways and you don't really feel it exactly where there's pain. And this is just one of those tricky spots. And since we're always on laptops and computers, or if you're leaning over patients, if you're doing injections, IV stuff, there's a good chance you're putting a lot of pressure up in here. So we're here to help you out with that. So talk about a little bit, a lot of my people have been asking about stem cells. Can you elaborate on that a little bit for us?
So actually stem cells are a fascinating topic, but I would tell all of your audience to really get a good assessment by someone that's unbiased and fair first, because the problem with stem cells, or biologics as they should be called, is that they are not a first-line treatment. They should be probably a third-line treatment, actually. And so things like manipulation, manual manipulation, as well as prolotherapy if you have someone with a really skilled hand, or platelet PRP, or platelet-rich plasma, also is something that should be looked at before stem cells or biologics are jumped to, because of the cost. And they're not really active once you inject them in the body. They really work by signaling our growth factors to come on board and be active. And that's really using your own body to, or using kind of recruiting your own body to work for itself rather than against it. So you really have to kind of make sure the patient's in a place where they're not in an inflammatory state, they're not eating inflammatory food, and until all that's been looked at, you're really not doing the patient a service by jumping right to biologics or stem cells. But if all that's been done and the patient has been looked at otherwise that way, man, that's a great way to help people heal and to recruit acute inflammation in the body that works for you rather than against you.
Okay, interesting. And what I've seen anecdotally speaking is, maybe 60-40 response rates from some of my patients, but I haven't really had any negative effects. Is that something you sort of noticed too, other than pocketbook being a little bit lighter?
You're aiming to that one. Yep. So, yeah, absolutely. But, some of the studies we're just not sure about. This is a really new field. It's it's trendy, it's cutting edge. It does work, like you said, about 60-40, especially if you have a skilled person that's good with injections. So there's a lot of confounding factors here. However, the problem with stem cells is that they're grown in bovine serum, so that they won't reproduce in human serum. They won't expand that way. So people are taking them, growing their own mediums, patenting their own mediums, and then trying to reproduce these stem cells in their own bovine growth factor. And so you can imagine that some of the immune responses that might elicit in humans aren't as favorable as it would if we were growing it in our own human serum, right?
Right.
So there's these things that are kind of left out in the air that we haven't really answered properly yet for a lot of people.
So it's kind of like the holy cow of medicine.
Yeah, totally.
That's a bad joke. Yeah, so
that's a great joke.
And the reason why it's so expensive is because it's not FDA approved yet. Is that correct? Because there hasn't been enough trials done on it. It
is not, absolutely, guys. And the thing is, the studies that have been done on stem cells, they took 3 commercially available biologic or stem cell products, and there were no live mesenchymal stem cells in any of them, none of them. So, but people still got benefit from them. So what is it doing when you inject these stem cells? They're recruiting your own stem cells through parasites American effects. They're recruiting your own growth factors, which then recruit your stem cells. And that's how they're working, right? But if you've got them in a little bit of fluid, you're storing them for so many days in a cold nitrogen, liquid nitrogen tank, there needs to be, what studies show how and when those stem cells degrade? When do they quit working? How long can you store them? So immediately when you inject them, the inflammatory response ensues. So do they survive that? There's a lot of questions left unanswered for a lot of money.
Right. Makes a lot of sense.
Ooh, yeah, that's all moving.
Yeah, you're hearing a lot of people that are like going to Colombia or Panama and paying $25,000 or something like that.
Yeah.
No guarantees, really not a lot of research, and they're willing to fork out that money.
Yeah.
And it's kind of like, well, I guess depending on your financial situation, if you've got it like that, it's something else. But there's a lot of people that are sort of working class heroes that they'll hear a podcast or something and they'll dump their entire family savings or their college tuition on something that they just don't know will or won't work yet. And sort of what I talk about is like the conservative interventions that you start with, they help to rule in or out a diagnosis, right? So like if something works for you, that sort of validates the diagnosis that you were expecting to begin with.
Right.
So if I gave you an antibiotic and you had a chest infection and it worked, then we know that we're on the right path. If it didn't, maybe we need a different antibiotic, or who knows, maybe you have a viral infection or a fungal infection or something else.
Exactly.
So, the response is what matters, and that's why we always talk about results-oriented care, acknowledging the literature but not being wholly dependent on it.
Right, and I will say, I don't mean to completely, harp on stem cells and give them a totally bad rap. They are great for a lot of people, and they do wonderful things when the patients are completely vetted in the proper way, and they're prepared and expectations are light in the right way, and people do their research.
And that's sort of the key for everything in medicine, right, is doing your research.
Do your research.
Knowing you have a physician or another healthcare provider that has done their due diligence, that has spent the time to look at you as an individual, and is sort of vested in the process, because I think a lot of times you end up at sort of like a McDonald's of medicine, whether it's a doc in the box or even some of the chiropractors out there. And if everybody's getting the same care, well, when you look at your Gaussian distributions, we know that's really not going to be all that effective. Maybe we're getting 30% that are doing well, the center of your normal curve. What about the periphery? If you see 100 people a day, if there's 4 right there, they're going to be the extreme derivative. So if something only works for 4%, do we ignore those people or do we get them the care they need?
Exactly. And so that's why tailored medicine is so very important. I always stress to my audience too, one size fits all medicine is bad medicine.
Yep.
I'm sorry, every time.
And that applies for alternative care and everything else too.
Yeah, absolutely. And I sell supplements, and I tell people supplements aren't enough. You got to change your life. You got to eat eating the right food.
Yeah,
I'm in it to help others while helping myself. So I have to be honest with people. There's no magic bullet.
There's a lifestyle.
Yes.
Well, they were talking about the Democratic debate the other night. They were like, we have a sick care system, so what are we doing about X, Y, Z? And it's like, well, this is a little more complex than that. What are you going to treat people that don't have problems yet? Because sort of the issue we have here is we're abundant. We have a really wealthy society, and people have a hard time with self-control. And now, we're wired to conserve energy, and we're wired to consume calories. And when they're so accessible, as we're seeing in China and all these other places around the world, obesity skyrockets, diabetes skyrockets. So there has to be a cultural change. It's not something that politicians can just put into place and think that it's going to change anything.
Totally.
Like we have to have a cultural shift. And I think that people like you are sort of at the forefront of changing that lifestyle medicine, and that's a really cool thing.
I appreciate that. Thank you so much. I just feel like medicine has been misrepresented, and people think that you can just take a magic pill and you should feel better, and that's what health is. And I'm here to tell people I wish health felt that great.
Right.
Healing feels terrible.
Right.
And you get worse before you get better, because if there's something hiding in the body that it needs to recognize, the body has to feel that and see that before it can change that. And that doesn't feel good. Right. That's your body that gives you that fever. That's your body that gives you that swelling and that pain to push things out, right? It's screaming at you.
Vomit or have diarrhea or something like that. It's like, let me just take a bunch of Imodium. Well, maybe your body needs to get rid of something.
Smarter than you most of the time.
Most of the time.
Absolutely.
Yes.
Yeah.
Let's do this. I'm going to have you long sit. So you're going to sit right here with your feet on the table facing that way.
Sure.
We're going to do a thoracic mobilization.
Oh, wow. That sounds important. Okay.
Well, it connects your neck to your lower back, so it's pretty important.
Pretty important.
All right. Okay. So give yourself a big hug.
Okay.
So self-love is also important. I'm going to go right back over like that. Deep breath in and blow it out.
Ah.
Very nice.
Oh, I hope you guys heard that. That was great. Yeah.
Okay, let's go lay face up.
Face up, okay.
And so what that does is, one of the biggest problems with the cervical spine is actually stiffness in the thoracic spine. So you'll create extra motion in your cervical spine if your T-spine doesn't move that well.
Okay.
And when we talk about the T-spine, a lot of times we're talking about the relative position of the scapulas. Most of the muscles that tie in your neck attach to your scapula. So if your shoulder blades roll forward, all of a sudden you can't get your T-spine back, and now we have a biomechanical issue.
Oh man, so my shoulders are rolling forward is the problem.
Relatively, depends on your reference point.
Okay,
or your T-spine's too
interesting.
far back. What we just did there was we blocked the T-spine to move the shoulder blades back relative to that position.
Okay.
Now there's a shorter distance from the top of the scapula to your neck, so those muscles aren't overstretched now.
Okay.
But that's temporary, because now you got to stretch and strengthen.
Okay.
So we have to get you in the right position, but then you have to do the work, just like in everything else, right?
It's always that way, isn't it, though?
Yeah, and you feel a little stuck there?
Yeah, it hurts there. Actually, it's tender,
Yeah.
for sure.
All right, so we're gonna do a little mob here too. So bring you around the corner, wiggle your left big toe a little bit.
Wiggle it?
Yep.
Ooh, I like that. I mean, I like that a lot. Okay.
Yeah, there we go. Okay, and this time I just want you to drop your left shoulder down a little bit.
The art of distraction.
Yeah.
Oh, that feels so much better already.
All right, we'll go ahead and sit back up. Yeah, and maybe you face that direction.
Okay.
So give me a big sassy hip like this.
Sassy hip.
Yep. All right, pull this elbow straight back. Good.
Back, Jess.
Same thing here.
Okay.
And goes there, and pull back. Pull. And that one's solid. The right-handed?
Nice. Yeah.
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 And it's just the thumb.
Oh my goodness. Can you check my elbows too? I feel like my elbows are out. They bother me a lot.
Like here?
Like a bursitis type of picture, like right there. Like right in there.
Ah. That's probably your lateral head of your tricep.
Yes, it is.
That's sore?
Yes, that's sore. Oh.
So you can foam roll this pretty easily or use like a dip handle.
Is it from handstands?
Probably.
That's handstands in yoga.
Yeah.
Okay.
But you can feel the difference in tone here. So the long head, lateral head. That
It
lateral head
feels
is killer.
terrible.
That
Yeah.
ties right in that area. And your elbow joint's sort of complicated, right? It does this motion and it does this motion. So it hinges and it pronates and supinates. So if any of the muscles that tie in go off, then you'll lose one of those ranges of motion.
Oh.
The other one's going to struggle a little bit too. And eventually it turns into bone spurs and,
Stuff I don't want.
yeah, pointy elbows.
Nah.
Hi, babe. Pointy elbows. We still never explained that joke to Noelle. That one's good there, actually.
That one's good. Okay.
It's just, you got to work on the tricep. Maybe a little pronator teres too.
That's so sore right there. Wow. It's amazing.
So what I'm doing is blocking off the pronator, but then forcing into supination, so he elongates the muscle.
Oh my goodness.
Attaches from here to here.
So just rotating will help that.
Yeah.
Okay.
But it helps also if you pin and stretch it like I'm doing here. So either with your other knuckle or,
Wow.
yeah, there we go.
It's starting to, it just gave loose. You can feel it actually when it gave way.
Totally.
I wanted to tell you too, while you're working on this side, when I was born, I was born face up rather than face down.
Okay.
And they took forceps and flipped me, and I flipped back over again. So they took forceps and re-flipped me. So part of my neck issues and cervical issues that you're seeing, is that something you see a lot where babies had maybe traumatic births?
I don't know, honestly.
Yeah, you don't know?
That's not really a...
I know too much history.
Yeah, I generally don't deal with kids very often, so I kind of treat between 15 and up. But I definitely do know there's some chiropractors that and osteopaths too that focus on that kind of stuff.
Yeah, I just
So-
wonder how it could affect adults.
I mean, I could certainly see the biological plausibility for sure, but I just don't know.
Interesting.
Also, I don't remember Pythagorean theorem either, so
Yeah, I don't even know why we needed to learn that.
Right.
Honestly.
I could probably pull it out actually. And we were having a debate the other day on because we use the term power and force so just flippantly in our society. And I'm like, no, there's a physics property for it. And I think what's power again? It's I think it's work times distance traveled, so over time in seconds. Yeah.
Yeah, I think you're right.
So when somebody's talking about power, like there's actually literally power.
No.
Right? That guy's got a lot of power right there, and I'm talking about physically, not like
Yeah.
societally. But I'm like,
Not so much.
I don't know.
It's not the
I don't think
correct
it's what
word.
I think it means what you think it means.
So this is literally just tight musculature that's causing all of that.
Just overuse.
Wow.
Yeah.
Okay.
So does that feel lighter than elbows now?
Yeah, it feels much better than it did. Absolutely. Everything felt stuck there.
And then see how the neck goes up.
And the headache's gone.
Perfect.
Yeah, the headache's absolutely gone. So,
Survived.
Yeah, thank you so
Right,
much
absolutely.
for my
Thanks for coming by.
treatment. Yeah, I appreciate it, bud. Thank you so much.
Peace out. Make sure to sub, drop some comments. If you hate chiropractors, make sure to comment that. If you hate doctors, make sure to comment that. And go ahead and start a fight in the comments. That'll make us generate some more revenue.
Yeah, we love debates. Go right ahead.